Good afternoon, everyone. Today is April 2024, and I believe, is it a palindrome as well? Uh, yeah, it is. My name is a palindrome as well. So, with that coincided, it's 4:07 p.m. As a quorum of the committee is in attendance, I would like to call to order the meeting of the Central Health Budget and Finance Committee. As a reminder, some of our community members may be also participating by video conference, so the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. Do we have anyone online?
Cynthia said she might be online.
Okay.
Yes, Madam Chair.
Do we have anyone? Any board members? Okay. Well, members of the public, right now, moving on to public communication. Members of the public who wish to make comments virtually during the public communication portion of the meeting must have registered with Central Health via the online form or by telephone no later than 2:30 p.m. today. Yesena, did anyone register to make comments for the Budget and Finance meeting?
Hi, Madam Chair. We have someone from our staff that would like to give a mission moment, if that's all right at this time.
That's at 5:30.
Mission moments are, we've moved them to 5:30. So we have a time certain moving forward at 5:30 for those. Is that correct, Chair?
This member is only able to give their time at 4 p.m., if that's all right.
Well, yeah, if they
Then-
can't do 5:30, that's okay.
That's fine. If that's their time constraint, I welcome them. So they're more than welcome to come and share their moment.
Okay, thank you. It is my distinct pleasure to welcome our health management liaison with Central Health, Kathy Edmondson.
Welcome, Kathy.
And I believe I see her here on the Zoom. You can unmute, Kathy. Kathy, can you hear us? I see an iPhone trying to connect to audio. That might be Kathy. Maybe her audio is not working on Zoom.
Um,
Oh, hi, Kathy. Can you hear us? I see you unmuted.
Kathy, can you hear us? So I see her name. You're muted, Kathy. Is she having difficulty? Does she have
I think so.
permission?
Kathy, I'm sending you the phone number right now, Kathy, if you can call in.
So while she's trying to join, I just have a couple announcements to make, given in light of their time constraint this evening. So, members, today, I would like to make an announcement that several of our board members will be attending the county judge state and the county address at 6:30 this evening. At 700 Lavaca, in order to ensure that we adjourn, all meetings will last longer than 6 p.m. And I would ask for presenters to keep their presentation on schedule and for the managers to keep their questions and comments brief. And this follows along all our meetings for this evening. And And I also like to invite all members of the board of managers and the community to join us at the address. While Kathy is getting situated, I'm going to give her a minute or so. I would also like to take the moment to appreciate you all for a heartfelt appreciation for your thoughtful comments and messages that I have received from people all around, people I've never met or known, and some who I've met in public that have really been inspired by some of the comments that I've made. And my comments really highlight the issue of humanity and the ongoing war that is currently happening in Gaza and the West Bank and in the Palestine. It is really heart-wrenching to know that as a Palestinian, every morning just waking up to know if a family member is still alive or not. That has just been a difficult time for many of us, and realizing the amount of the impact that has had on innocent civilians, primarily children who have lost their limbs, their family members, lack of access to food, safety, their home, their sense of security, and many who've been they've been out of school for over 6 months, and thinking about, what we here do is address inequities and how this is impacting generations to come. So I would want you all to not forget and to remember the ongoing situation that is happening, that is unfolding, that is being paid by our tax dollars. Unfortunately, this has just reached a height that we can no longer tolerate, and we call for peace and justice for all. And I hope everyone can really take a deeper dive into the situation and to look at it from an empathetic standpoint, and knowing the impact that it has on our community, on everyone that has a sense of humanity. And that's really the message. And this evening, I would also be talking a little bit about, in honor of April is Arab American Heritage Month. I would also want to highlight some of the greatest accomplishments that we have made to this society. And I thank you all, and I appreciate you for everything, and I hope we can all have a cordial conversation and continue to move forward in peace. Thank you. So I would appreciate if we can move along. Is Kathy on? So Kathy, if you're not on, we would in light of our time constraint, we would like to move forward, and when you're ready, we can pause if that's acceptable. Thank you. Now, committee, we are moving to agenda item number 1. Approve the minutes of the March 27, 2024 Budget and Finance Committee meeting. I move that the committee approve the minutes of the March 27, 2024 Budget and Finance Committee meeting. Do I have a second?
Second.
So a second by Manager Chair, by Chair Kitchen. Any discussion? I see none. All in favor? The motion moves unanimously. Thank you. I also want to welcome our new board member. I know we'll introduce you later on. Welcome, Ms. Eliza May. Thank you. Item number 2, receive and discuss a report of historically underutilized business hub spending performance for fiscal year 2023. And for this item, Belena Bunch, Margaret Castillo, and Nikki Riley will be presenting. Thank you. Welcome.
Hi, I'm Nikki Riley. I'm the Deputy CFO, and I'll let them introduce themselves.
Hi, I'm Belena Bunch. I'm the Procurement Director for Central Health.
Hello, I'm Margaret Castillo. I am the Senior Hub Analyst for Central Health.
I want to let you know that this has kind of been delayed, this report. In the future, it will be much earlier, but you probably remember that we did a disparity study recommended by the board in fiscal year '22. And so there were recommendations that came out of that disparity study. And so in '23, we have implemented those. And, excuse me, it took us a while to implement the software, get all of the data that we really wanted to get for a much improved report for you. So it's kind of late, our apologies. In the future, it will be more timely. Saying that, I want to just kind of give a little bit of a summary. It's all good news. We are able now to give you much more detailed data regarding the minority groups, the women-owned groups, what categories they're in. And we are setting goals now, and we have met that goal for this past year. So I want to commend our new outreach specialist and Belina. And team. They've done a great job implementing this in such a short amount of time. So with that, I will let them go ahead with their presentation.
Hi, Belina Bunch, Procurement Director for Central Health. We thought that it would be beneficial to kind of give you kind of a history of where we've come from the Good Faith effort to the formal hub program, as well as go over just a few basic things, because we know we have new board members, we have a new CEO, we also have new other staff members, and so we're going to just give you just a brief timeline. First of all, defining what a hub program is, and HUB stands for Historically Underutilized Businesses. The HUB program is an initiative that promotes and increases opportunities for small businesses, minority businesses, and women-owned businesses. And in order to qualify for a HUB business, it has to be at least 51% owned by a woman, a minority, or a service-disabled veteran. As Nikki mentioned earlier, when we go back in the timeline, in FY 2021, our Board of Managers and our CEO at the time decided to launch a disparity study in concert with Travis County. And then in FY 22, Colette Holt and Associates was contracted by Central Health. Colette is known throughout the state of Texas, being utilized by government entities specifically for disparity studies and HUB program initiatives. After the disparity study was conducted, in FY 22, she came back with suggestions or with recommendations that we hire a HUB specialist, that we create HUB goals, and that we purchase and implement a HUB software. In FY 23, we did just that. We hired Margaret Castillo as our senior HUB analyst. We set HUB goals, and the HUB goals specifically came from the disparity study. Colette recommended that the HUB goal for us be 14%, and that 14% was set and surpassed this year, thankfully. And also, we are in the midst of implementing our HUB software. Next slide, please. Next slide, please. Sorry. We also want to highlight what expenditures we can use towards the HUB. There's eligible expenditures as well as ineligible expenditures. Ineligible expenditures are stuff like HR services, benefits, utilities. But I want to specifically highlight that healthcare services are not qualified for HUB expenditures. And I know that we're going into the healthcare arena, but we can't count the dollars that we spend on those services towards HUB. So I wanted to make sure that everybody was aware of that. Next slide, please. As we look at our numbers, in FY 23, we did 63 solicitations, 48 of those which were informal solicitations, which are solicitations that are under the $50,000 threshold, and then 15 of those were formal solicitations. Of those 63 solicitations, we sent out over 32,000 emails to just HUB vendors alone. There was 260 proposals received from HUB vendors or prime contractors that included HUB subcontractors to work along with them to perform the services. 91 contracts were awarded in FY 23 because some of those solicitations were multi-awards. So we had some that had more than one vendor that we awarded to. We had 91 in total that were awarded. 15 of those awards were to HUB prime contractors, and then 5 of them were to prime contractors that had HUB subcontractors. Next slide, please. Our solicitations we have various ways that we post our solicitations. We post them on the Central Health website. We post them on the Texas Comptroller's website. We also post them on BitNet, which is a national platform that we use that expands our reach beyond the Texas borders. So we use BitNet. BitNet helps us with our stats, how many people they send it out to, who views our solicitations, and we've been very successful and satisfied with doing it on BitNet. Also, we have 4 local newspapers that we post our solicitations in, and they're account for both English and Spanish-speaking newspapers. And we also send our solicitations out via email to chambers and to trade organizations. I want to mention that the chambers that we send them out to are not just for the local Austin chambers. We send them out to every major city chamber. So Dallas, El Paso, Houston, all those various chambers that they have, they all receive a notice for our solicitations, and we ask them to pass them out to their members. And now that we have Margaret with us, she's also sending our solicitations out via in hub events, when she's attending hub events, or when she's sending emails, because she has access to certified hub vendors, and she'll send out a mass email to let them know that, hey, we have these solicitations coming up as well. Next slide, please. Again, because of Margaret being on staff, now we are able to go outside of the 4 walls in doing our hub outreach. So with the addition of our senior hub analysts, we're able to expand our footprint in attending various hub outreaches, as well as Central Health just recently hosted its own Meet the Prime event for one of our upcoming construction projects. And Margaret and team were able to go out with the prime contractor and meet subcontractors to let them know what was going to be coming up, what they were going to be doing, with the hope to what I call marry subcontractors with prime contractors so that they can receive some of the work as well. Some of those outreach events include Senator Royce West Annual Spot Bid Fair, the Texas Facility Commission's Hub Fair. The City of Austin hosted a small and minority business connection as well. And she does a whole lot more as well. And so we're so glad to have Margaret here. She's a networker natural. She's a natural networker, and I mean, she hit the ground running. And so we're excited about that. On the next slide, you'll just see some of the flyers and the outreach, what I just named. These are the flyers and the communications that she received for those outreach. She's on a hub networking list, so that whenever any government entity in the state of Texas, whenever they have a hub event, Margaret is notified. And we let her go do what it is that she does, so that Central Health can be known. I've seen her on emails that trying to encourage vendors that are minority owned, that are not hub certified. She's sending them. Central Health does not certify hub vendors, but she's sending them information to say, hey, go to the city, go to the state, and become certified. It will benefit you. And so she really is pushing not only to help Central Health, but she's helping hub vendors so that they can help Central Health. Next slide, please. So when we look at the numbers, we are looking at 2023 operating and CIP expenditures. We had $17 million in operating expenditures, of which 10% of that was given to hub vendors. We had $14.5 million in CIP expenditures, of which 36% of that was given to hub vendors. And overall, it was a $31.5 million eligible expenditures that we spent in FY 2023, and $6.9 million, or 22%, was spent on certified hub vendors, again, surpassing our goal of 14%. Next slide, please. I want to use this slide to give kudos to my team. I know Nikki has already done that, but I want to give kudos to the procurement team for working so hard. We try to encourage whenever we have purchases come through us and we look at the vendors, we try to encourage as much as possible to have you looked at hubs when we do solicitations, the informal ones that are under $50,000. We have a process that we use where we have to get 3 bids, and one of them has to be from a hub vendor. And so we're trying to promote that hub, as much as possible. And on this chart really compares us to the other government entities that are in our area. And I know Central Health has the smallest dollar amount, but we're doing the job to get it done in meeting the percentage. And so kudos to the procurement team in helping us get that done. It takes a village. It is not a one-man show. Next slide, please. Here we're showing a 3-year spend by classification, and if you'll notice, all classifications increased with the exception of Black-owned businesses. What we did when we went back to research that, we found out that we had a major contract that ended. So the money that was counted in FY22, we could not count it in FY23, but we have already taken action to try to promote Black-owned businesses. We went to the Black Chamber of Commerce, the Austin's Black Chamber of Commerce website, downloaded the link to their membership, and we're getting that posted. We're going to work with the communications team to get that posted on our website so that whenever departments are ready to make a purchase, right? Previously, we were just saying, look for a hub vendor. Now we're going to be saying, hey, can you look at the list of Black-owned businesses to see if, because we're trying to, get that portion up a little bit. And so, but otherwise, I mean, we did great. Everything else increased by classification. Next slide, please. We specifically created this slide for Manager Valadez, so I want y'all to tell her. I want y'all to tell her that she missed out. So in the past couple of years, we've given information on hub expenditures by gender, but we weren't able to deaggregate the woman category. It was Black male, Asian male, Hispanic male, and then woman-owned, all in one category. Again, Margaret, she's been wonderful. With her skills, she's been able to make some connections, and she's been able to deaggregate that information so that we can see how much money was spent on Black-owned females, how much money was spent with Asian-owned, Asian female businesses. And so this slide really gets down to the nitty-gritty is what I call it, because it's down to the bean counting and saying, hey, this is what we spent on and who we spent it on. Next slide, please. Since Margaret is out on the field and promoting Central Health, she needed marketing tools, and I want to give kudos to our communications team. They worked really close with us in developing flyers and a banner so that when she goes out, she'll be able to have this banner is standing up by the table. And then the flyers are both in English and Spanish. She's passing them out so that you guys can see what they look like. This is what the material that she distributes at the hub events. So that everybody, can know what it is that we have, what we're looking for. We want to have a presence, just like the bigger entities as well. Next slide, please. Finally, we talked about the recommendation from Colette Holt for us to implement our hub software. We are in the process of implementing B2G Now. And B2G Now, once it is implemented, is going to be a great asset to Central Health. Right now we have various people and various ways of getting information, sending out information, to hub vendors. It's coming in through email. They're making phone calls, relieving messages. B2G Now is going to create, I guess what I call is a hub for hub software so that it can be customer facing on both sides. And so Margaret is able to use it. She sets up the paperwork that the primes need to have, they need to fill out. And then on the other side, the primes can still come into B2G as well and do whatever it is that they need to do. B2G helps us to be compliant, where when we're looking, we have these hub goals that we have in a contract that is set for the contractors and for the vendors. And if they're not meeting it, B2G will give Margaret an alert so that she can contact them and say, hey, you're not meeting your goal in this area. She sends them more certified vendors to say, can you choose from this vendor? Or if they make a change and they come back and say, we're not going to use this vendor, but we'll use another. If it's not a hub certified vendor, she will send them a list. And so B2G helps us, and she's utilizing it right now actually for 2 contracts. It's just not fully implemented, but it is and has been helping us since we've had it. And so once we get it fully implemented, I'm excited about it because it is going to be a great asset to Central Health. And so that's my spiel. I am going to turn it back over to Nikki. Thank you very much for listening.
I wanted to add one more thing to the BTG now, because when I first got here, I didn't really understand how the software helped. And it's actually not a software that we just use. City of Austin uses it, State of Texas uses it. And so we're able to all put input, but all see it. And so when we have a prime contractor with a hub, the prime contractor for the compliance can go in there and say, this is the amount that I have paid the hub. And then the hub can actually go in there as well and validate and confirm that that's what they've been paid. So we can make sure that they're meeting their goals and paying on time, which I know in the past, in my experience, there have been some issues with that. So it's a really good way to just not only make sure that they're meeting their goals, but paying their subcontractors on time. So is there any questions? I know she is dying to say something.
Well,
But she is the one that has been going out, that has been calling. She's really, really personable. And I know that the hubs have really enjoyed meeting with her and being able to see how they can get in on the Central Health. Mostly construction projects is what we've been focused on. There's I think another couple categories that we've been focused on. But yes, if anybody has any questions about what
first
she's
of all,
done, that'd be great.
thank you, Nikki. Thank you all so much. Really, thank you. Amazing work. I'm really proud of everything that you have been achieved. You achieved since last presentation. This is really extraordinary, a jump, and thank you. Cannot thank you enough. Now, in light of the time constraint, I am gonna make sure that our board members be very careful with their time. If they have any questions, I'm sure several of them do have questions. Just wanted to remind everyone about our time, that we need to end this meeting, my meeting by 5. Chair, do you have a question?
I'm going to have a 30-second question for
Thank
you. Tell us what you're enjoying about this job.
Working for Central Health has been, we're like a family-based area. Procurement we're a team, and we get together and we work together. So the networking with small businesses out in the community, just interacting with them, getting them connected with Central Health's website, solicitations, and making sure that they're certified and stay certified. So just the interaction with everybody has been great.
Thank you.
Thank you. Any further questions? Manager Jones?
Yes, thanks very much. Appreciate it, and thank you for the great work here. This is to be commended. Just two quick questions.
Please go.
One is on the data you provided, particularly is concerning. You alluded to the fact that particularly with the African American hub expenditure classification. Is there anything that you can contribute to that? Why that is so much lower than we anticipated?
In FY21 and FY22, Colette Holden Associates in particular are classified as, or their classification is registered as a hub, prime hub, African American female. Also, the DEI vendor that we had was also African American, and they were hub certified. And then those 2 contracts fell off in FY 2023. And so the dollar spend that we had with them, which was huge, fell off, and that majorly contributed to the downfall and the decrease in that area spend.
So it's the vendor, uniqueness of the vendor in the situation there, okay.
Yes.
And we're working to address that.
We are.
Okay.
We are proactively working to address it.
I've received a couple of calls from individuals who are interested in bidding on contracts for our construction. So who should I refer them to when I get those requests? To you? Okay, I'll do that. And the last one is, relates to this on the female. The disparity there is quite significant. Is there a challenge in terms of trying to get the dollars to African-American males?
The reason, I can tell you the main reason why the disparity there is construction. Construction is a big contributor to this year's FY23's report. And the Hispanic male construction companies are, owned by them mostly. And so we are partnering with, or we have partnered with the Black
Contractors Association.
So you're working with
Margaret,
those?
yeah, yeah, Margaret has met her. She knows her personally, and every time we have a construction solicitation or anything that we have, she is sending it directly to Ms. Hadnot at that at the Black Contractors Association, so that she can post it for the members to see.
Okay, I'd be happy offline to maybe meet and talk with you about some other strategies you might want to cover. Thanks very much, appreciate it.
Thank you,
Keep us
Manager
good work.
Jones.
Thank you.
On that slide that Manager Jones referred to, for the Native American female and Asian Pacific male, the dollar amount is blank. Is there a reason?
It's 0.
Say again.
Okay.
This one. These are state categories. Federal state categories.
So, okay.
And so we listed those categories,
So
and
basically-
there's just no dollars in those.
Thank you. Manager Motwani?
No question. Just want to appreciate, first of all, it's very, very obvious team chemistry across the reporting line. Y'all are working really hard, and over the 3 and some years that I've been with the organization, Belinda, I'm so impressed to see the work that y'all are doing to make this happen, and really, literally, to systematize it. That's what needs to occur. And not only that, but the cross-functional call-outs, I'm really inspired. I appreciate it. Thank you all so much, and welcome, Margaret.
Thank you, Manager Motwani. So, thank you all. If there's no further questions, thank you. Appreciate it.
Thank you very much.
Now, moving along to agenda item number 3, and it is receive and discuss instructions for submitting board member recommended fiscal year 2025 emerging priorities. Monica Crowley will be presenting. Managers, I want to allude you to 2 documents on your desk. These are the 2 documents that she will be referring to. These are 2 separate documents. Just want to make sure that you have it in hand, and while Monica will be presenting. Welcome, thank you.
Thank you, Monica Crowley, Chief Strategy Officer, and thank you, managers, for engaging in this collaborative process with us this year. This process is part of the strategic priority and budget development timeline, and the opportunity that we have today, you had instructed us to come back with a process that described how managers could participate and collaborate with us in the timeline for the budget development strategic priorities process. And so that is found in this document. It's a 1-page document that describes how to fill out the form, who to get the form from. Like I warned her in advance, Brianna Yanes is going to be heavily involved in this process. And so just highlights from this are that the application, or not the application process, but this recommendation process becomes active today and continues through Wednesday, May 24th. And this is part of this timeline process that that Pat has brought to the board so that we really have a process for smoothly running all recommendations for strategic priorities and budget priorities through recommendation and evaluation process that then we can bring back as part of our ongoing discussion with you as board members, so that when we get to August and September, there aren't any surprises around the budget and everything has been through a transparent and collaborative kind of pre-agreed upon process. So if board members have ideas about emerging priorities, the first thing we would do is we would ask you to go back and review this board validated and suggested driving forces these are the forces that we collaboratively and collectively discussed were kind of driving potential needs for emerging priorities that aren't already part of our ongoing strategic plan that was board approved and it has work underway. Then if you have a recommended emerging priority, please reach out to Brianna, and you can either take the hard copy that we have here today. The recommendation form includes 10 potential questions that managers could fill out. And you could either use this form, you could handwrite on the form, you could type in the form, you could ask Brianna for a live link that you could upload information to. You could call Brianna and ask for, I'd word Brianna, there's gonna be a lot of Brianna involved in this process. You could call Brianna and ask for a connection to a staff member who could help you complete the form, or, you know, just help with the submission process. We really appreciate that you guys are collaborating with us early on in this process and want to make this process as easy as we possibly can for you and help facilitate you working through this process. And then we're asking that just with as much information as you have or working with staff to have the submissions in by May 24th. After that, we're going to catalog all of the submissions that we've received. And then as an executive team, we're going to work with Pat and then go through some consideration criteria, which are included on the one pager, like how does the priority align with the board validated driving forces? How is the priority relevant to the needs of the population served by Central Health? How will the priority improve equity, care, and the health of the population served by Central Health? How can the success of the priority be measured? And then how feasible is the priority today for Central Health? And then come back to the board on June 12th with the entire catalog and then staff recommendations kind of based along these criteria for discussion with the board, and then we'll take additional feedback from the board on the prioritization of the emerging priorities. There's a lot of priorities there. And then take your feedback and then follow up with the board at a TBD scheduled meeting in early July, kind of based on people's summer schedules.
Well, thank you, Monica. Does that conclude the presentation?
Yes.
Thank you so much, appreciate it. Just a couple things before I open the floor. On this form, if you can make the board name required, and if possible, that you can send all these documents in a separate email along with the link to board members. I think it'll be easier to access, and whenever they have an opportunity to submit. So I assume each submission equals one recommendation. So per recommendation, per submission per recommendation, I guess. That's it. And another thing, let's say in June you come and compile them, and if there were priority recommendations by board members that did not make make it to a list. If you can provide us with a list, maybe that's for future consideration, and if there's an overall theme, and if there's something that we have missed, I would appreciate that. So at this time, I'm opening the floor if there's any questions by any committee members. Chair?
Do you want to go first?
Yeah, my question is brief. Thanks, Ann.
Yeah. You can go first.
Sorry, I didn't see you.
It's okay.
That's okay. I won't take it personally. So, just to clarify, once these initiatives are set, this process has occurred, there'll be the initiatives are sort of set in stone in terms of not having a late initiative delivered in November, or say, that's the plan. If it's not presented at this time, it will not be addressed this year in the budget. Is that correct?
I'm happy to respond to that. I think we understand that things like COVID can occur outside of our control. So with that important caveat, the hope here is that by engaging with the board in this iterative process, what's out there that we need to prioritize, what are the emerging priorities and objectives, how should we address those together, how are we going to assess those in an objective apples to apples way, here's how we shook that out and what came up to the top and what else is there, and getting feedback all the way through, that we will then have gotten the key ideas and priorities out of our own minds, and potentially also invited input from our county commissioners or others in the community, since they know that this process is there. They may approach you to carry an idea forward. And so the good ideas will hopefully have been paired up with those priorities, and there won't be a need for us to drop an idea at the end. Or if an idea occurs, we can refer back to that process and ask, is it truly an emergency that should bypass all the process we've gone through, or can we allow that to roll forward next year as we do this year to year? So this would be the intent, that there's a season for planting and a season for harvesting and so on. This is the season for the ideas to come forward, and we welcome this. And as I've said earlier, this is a first run. This is a learning process. We're going to make some opportunities for improvement. We welcome your feedback, and we'll continue to improve as we go. So I don't want it to feel rigid, but the aim is engagement, alignment, and getting our best ideas out in a mature and orderly process toward the budget. Thank you, John.
Thank you. Yeah.
Yeah, I just wanted to reiterate that this is a new process, and it comes from a desire of the board to not be doing budget amendments at the last minute, and acknowledging that, it's possible that we might have emergencies that do come up, and then we'll just have to assess if it really is an emergency that needs to be addressed. But the intent is to really do our thinking now and share that with you all, and so that there's time to vet ideas and then build it into the budget. And that I'll just emphasize for everyone, just as a reminder, this is all on top of what we already have going with the health equity plan. So, and on top of that, to be folded in to that. So thank you. I think it's a good process. We will all do our very best to address everything right now and think of it right now, and avoid emergencies that require amendments on the day we adopt the budget. And I'm one of those persons that did that. So I think this is a better process.
Thank you. Manager Zamora, do you have any comments? Thank you. I'm just going to go Manager Motwani, I think. Manager Jones.
Just one quick question. In terms of interpretation to the chair's comments, how our interpretation, what falls within the well of changing landscapes and making recommendations, is that are we going to weed out at some point whether or not that falls within this?
I think that's part of what staff will be looking at. Now, again, this is designed to be not a rigid process, a process to guide ideas. We think that we've identified everything that we might be thinking of in these driving forces. So, I want to caution that we're not, we all have responsibilities as board members to the community, and we're not going to tell anybody that, no, you can never bring anything. But what we are saying is, yes, please think about it now. Yes, please think about how it fits. Yes, please work with staff so that when it comes back to us as a whole board, we can think about it and talk about it. But yes, it should fit into one of these.
Okay.
And
Did that answer your question?
Yeah, does. I just want to make sure I'm clear in terms of that interpretation.
Okay,
So also just managers, this is the first time, this is not perfect. There might be additional iterations, just rest assured we'll adjust it. So maybe there's something that we have not thought thoroughly about. So just be aware of that, so it's new. Manager May, do you have any comments? I know that you're new. Thank you all. So at this time, we do not have anything. Thank you. And one final thing, Brianna, if you can also send a reminder to folks a week prior that this is a hard deadline, I think that would be appreciated. Thank you so much. Now, moving along to our the last before our next item. It is item. Where is my notes? Thank you. Agenda item number 4, receive a presentation on the March 2024 financial statements for Central Health. Now, we have a few minutes for this presentation. Ms. Nikki Riley and Patty Bethke will be presenting. I understand you may need additional time than that. Maybe if you can just give an overall summary, and this will, the reports are included in the packet. So just allows if there's any questions for board members. Thank you.
All right. Good afternoon, managers. I'm Patty Bethke. I'm the controller for Central Health. Very quickly, we'll just go over the financial statements. It's on the 3rd page of the packet for financial. Sorry, go one more, 4th page. We continue in our balance sheet. We continue to see very strong cash position. We have $714 million in cash right now. Our total assets are now at $1.5 billion. And going down into the liabilities, our total current liabilities are at $42 million. And of note, in March, we made our annual debt service payment. And then we'll be moving forward on the next one. This has increased since last year due to the new debt that was issued in the summertime. Our total liabilities are at $508 million, and our net assets are at $949 million. That gives us liabilities and net assets of $1.5 billion. And then moving on quickly to the sources and uses. Of note, we're 50% of the way through our fiscal year, and our property taxes are now at $311 million, which is 100% of our total budgeted revenues. In investments and other revenue, we continue to see favorable investments to the budget due to our conservative budgeting process in there. And so our total sources now are at $377 million for the year. This is also 100% of the budget. Under the uses of funds, in healthcare delivery, we've invested $24 million in healthcare delivery in March. And we are now at $110 million year to date, which is 37% of the budget. With the administrative program, we're at $13 million for the year, which is 43% of the budget. So our total uses year to date are at $131 million. This is 36% of our $369 million budget. Our year to date excess sources over uses is now at $206 million. And moving on to the next page, 2 pages down. We want to look at the details of the healthcare delivery. And in here of note is the specialty behavioral health and substance abuse at almost $4 million for the month of March, and now at $7.3 million year to date. And this month we included some estimates for estimate reserves for our expansion of services in the behavioral health based off of our new contracting this year. And that, I think I will end it there if anybody has any questions. I'll do the other 2 slides.
Thank you for the reminder. So there are no questions. I just want to appreciate you all for your hard work and due diligence, and that if there's nothing remarkable, it looks great. Thank you. And just to let board members, if they have any final questions, if they have any additional questions, they can follow up with you on these on this report. So I'm going to go again around the table. There are not any questions. Dr. Lee?
Manager, Executive Chairman Saitef, could I invite John Morgan to lift up one interesting point
Yes,
from
please.
within the healthcare delivery piece that we wanted to share with the managers so that we were connecting some of the dots here. Thank you, John.
Thank you.
Thank you for the opportunity. I'll be very brief. Just to add a bit of additional context to one specific line item, our dialysis line item related to the specialty care slide. So there's a lot of context behind every line on these slides, but for that one in particular, wanted to recognize a few updates. One is this year we've had some savings opportunities related to dialysis, even though we're continuing to grow that program. And that opportunity is really a testament to the unique situation that we have with a community health plan and Sendero being here in town. So we've had an opportunity through the ACA marketplace that for a temporary period of time, we can enroll our dialysis eligible patients into our health plan on a continuous basis, not just during the open enrollment period. So we've been able to take advantage of that with our partners over at Sendero. So we're keeping people in the transitional dialysis program here at Central Health for a shorter period of time and getting people into that permanent coverage faster, which has been fantastic. And the other piece of this is, so that aspect has generated a savings for us in the first half of the year. But the second half of the year, I'm also happy to share an update that we've been able to come to agreement with our partners over at Ascension to both extend and expand our dialysis program. So that program, or our pilot, was really scheduled to come to an end at the end of this calendar year. We're now extending that out through, I believe, the end of 2027. And we're also going to be able to extend that program as planned to our MAP basic population and to earlier stage kidney disease patients. So up to this point, it's been limited to MAP patients with an ESRD diagnosis, and we're going through the process now to operationalize the expansion, but we'll be able to include MAP and MAP basic, as well as our CKD 4 and 5 patients or others who would benefit from outpatient dialysis going forward. So we're excited to share those updates. A lot behind the numbers, savings in the first half of the year, but we'll have some additional costs in the second half of the year, even though we'll continue to do the continuous enrollment into the Sendero products in partnership with leadership over at Sendero. So happy to answer any questions.
I am glad we're able to work around our differences for patient care. Thank you for that update. I think we're all happy with the progress. My quick question is, how many patients in terms of, and when you're talking about savings,
Yes.
what is the percentage of savings? Just out
I
of
can bring
curiosity.
back more detail on that and an update, if that would be okay. I don't have those numbers off the
Sure.
top of my head, but I'm happy to bring back more information.
But again, thank you for all your efforts
Yes,
and for
ma'am.
your team efforts. Appreciate it. Any questions, please? Dr. Miller?
Don't leave. Could you, maybe break down a little bit the expenditures for specialty behavioral health and substance use?
I can. I don't have those numbers in front of me, but the specialty behavioral health and substance use consists of a group of probably 5 or 6 different agreements. We have our agreement with Integral Care. We opened up a new access point for medication-assisted treatment, so Suboxone services for individuals with co-occurring substance use diagnosis and serious mental illness. That budget would also include the MAT services provided through Community Care, so their Suboxone clinics, and that's continuing to grow, and we're actually in the process of looking at a site expansion opportunity for that service so it can continue to grow. we're not quite at the level of access that we would like to be at. So we're continuing to add care teams, and right now we're limited in how much we can expand that service without additional space for community care. So Southeast Health and Wellness has been the main hub site for those inductions at community care. So we're looking for a more north location that can also be an induction site, even though maintenance is done throughout the primary care system. We also have our 2 methadone contracts, one through Community Medical Services that provides methadone in 2 locations, and then Dr. Oshbach's group provides access in South Austin to methadone. And I'm sure I'm forgetting something that's in that budget, but those are the agreements that come to mind.
Thank you.
Yes, sir.
Thank
Any other
you.
questions?
Any further questions? Yes, Dr. Lane?
Very briefly, thank you, Chairman Saitov. Thank you, John. Just thought this was a good opportunity to lift up, the value of the strategic partnership and asset of having Sendero Health Plans in our family. And part of our commitment is to continually work to try to help trace those lines of how our role as a payer, in addition to having the health plan as part of the network, is valuable to us. And so this seems like an opportunity to just flag that number there and tell that story. So thank you, John, for doing that, and thanks for the opportunity.
Thank you so much. Okay, thank you all so much. Before I conclude this meeting, is Kathy on the line? If she's not able to, would it be possible if she can record it, if that's a
So let's
possibility?
just see, is she gonna come back at 5:30, or what do y'all know?
I think she might do it
Maybe she
next
can
month.
record it.
I think she
What'd you
might
say?
come back next month.
Okay, all right.
Okay, but if she's not able to, perhaps a recording that can
Yeah.
be on our landing webpage as well for the community to witness the amazing work that you all have been doing. So with that, I move on to my final agenda item, confirm the next Budget and Finance Committee meeting date, time, and location. Managers, our next Central Health Budget and Finance Committee is tentatively scheduled for Wednesday, May 22nd, 2024 at 4 p.m. at the Central Health Headquarters, 1111 East Cesar Chavez, Austin, Texas, 78702. At this time, I am ready to accept a motion for adjournment. I have a motion by Manager Kitchen, a second by Manager Ratwani. Any discussions? I see none. All in favor?
Aye.
Aye, thank you. Meeting adjourned.
Okay, good afternoon, managers. Today's March 24th, and it is 5, oh wait, it's April. Sorry. I'm just reading, y'all. So, okay, good afternoon. Let me start over. Good afternoon. Today is April 24th, and it is 5:04 p.m. As a quorum of the committee is in attendance, I'd like to call to order the meeting of the Central Health Executive Committee. And I'd like to first announce that in order that what we're going to be trying now is moving our public communication to 5:30. The thinking is that it will be more accessible to community members. So we're going to hold public communication for both the executive committee meeting and the board of managers meeting at a time certain at 5:30 p.m. So that's what we're going to move forward with after this, from this meeting forward. And we're going to try that and see if that's more accessible for folks in the community. So we will now proceed to the executive committee agenda. The first item on the agenda is to approve the minutes of the Central Health Executive Committee board meeting. And we have the April 24th meeting, 2024 meeting. So do I have a motion? Okay, you want to? Motion from Manager Musaidov that the committee approve the minutes of the Central Health Executive Committee April 24th meeting. Second from Dr. Martin. All in favor? Aye. Okay, the minutes are approved. We move on to item agenda number 2. Review and provide direction to staff on the prioritization and tentative scheduling of items for considerations at future Central Health Board and committee meetings. And so Brianna Yanes will be presenting. Yes.
Yes, I'll go over all May agenda items, starting with strategic planning. We have present staff emerging priorities, a healthcare equity definition update and discussion, a higher ed workforce recruitment update, a communications update, and then an annual report. And then we'll also have another strategic planning committee meeting on May 22nd with the rest of our meetings. At that meeting, we'll present FY25 proposed strategic priorities derived from business cases. And then at Budget and Finance on May 22nd, we'll have financials, Q2 fiscal and operational updates from CUC and Sendero, the financial forecast, the process of CEO financial contract authorization. For Executive Committee, we'll have our regular standing items of tentative schedules. And then for the board meeting, we'll have lawsuit updates, performance review update, CEO update, integral care update, and a unified branding update. And then we have Travis County Commissioners Court work session scheduled for May 9th. And that's all I have.
And that was the, could you just quickly go over the June ones for folks?
June, okay.
If you have that, if you don't, that's.
Yeah, so in June, we have the Infrastructure Committee meeting on June 5th. Let's see. These items may not be as finalized as the May.
Okay, well,
they're
that's
kind of
okay. We
more
can just look
draft.
at them.
Okay.
So managers and Manager May, what we're doing here is every executive committee meeting we go over our agendas for the next quarter so that people can have an eye on what's coming up, and we can also comment if there's something that we see that we want in particular to be on an agenda item. So that's what we do. Okay, does anybody have any questions or comments? Manager Jones?
Just a question, and I know it may not go out far enough, but have we made any entrees to the retreat discussion we talked about and planning that out?
Yes. I believe we have on our, it may be June.
The June
Yeah.
Executive Committee agenda, we'll talk about the retreat agenda and then dates.
Because that includes our retreat.
We're talking about our retreat, yes.
Board,
Yeah,
But
the board
have we
retreat.
looked at or approached to consider talking about retreat? We talked about other boards, particularly in the enterprise.
Oh, yes, we have a meeting, I have a meeting scheduled with the chairs of Sendero and Community Care Boards, and we're going to talk through what their thinking is on the best way for our boards to get to know each other and have a meeting. And then I'll bring that back to all of you and we can comment on that. So yes, yeah. Any other questions or comments? Okay. Let's see, there's no motion necessary for this item. So we will go to the third item, confirm the next, which is all we have left in executive committee, is to confirm the next regular executive committee meeting date, time, and location. So managers, our next Central Health Executive Committee meeting is tentatively scheduled for Wednesday, May 22nd at 4 p.m. or immediately after the Budget and Finance Committee at this location here, 1111 East Cesar Chavez. At this time, I'm ready to accept a motion for adjournment. Motion by Dr. Martin, second by Manager Musaitif. All in favor?
Aye.
All right. We're now going to move into our board meeting. I can find my, oops. Okay. All right, so good afternoon. Today is April 24th, and it is 5:10. As a quorum of the board is in attendance, I'd like to call to order the meeting of the Central Health Board of Managers. So before we begin the meeting, I'd like to take a moment right now to welcome our newest board manager, Elisa May. And I want to say just a few words, and then I want to invite her to introduce herself to you all. I've had the honor of knowing Elisa for quite some time, And I want you all to know that she was involved in getting Central Health started when we did the campaign eons ago. And I've just known her over the years. She's a longtime local advocate on healthcare. And she will be just a wonderful addition with all of us. So, Elisa, if you'd like to introduce yourself to folks and let them know something about you.
Thank you. Thank you very much. Oh. Yeah. Right there. Thank you very much. So yes, my name's Elisa May. I have lived here in Austin for a very long time, pretty much, I think as long as I've known you, Ann.
Yeah,
I've been involved in a lot of community issues and initiatives. I recently retired from the Susan G. Komen Breast Cancer Foundation, of which I was a VP of Mission Services and Outreach, which was quite an expansive program with 39 counties under my belt. And obviously, healthcare issues and equity, serving the uninsured and underinsured were critical items that I had direct authority and had part of my span of control. I'd like to also mention that not only did I work under the beginnings of getting the Central Health program off the ground with respect to the initiatives, the Citizens Initiative, I also was involved in making sure that we had mammography services within the the community cares programs. We were really fortunate to have enough money to be able to fund their first mammography machine. So that'll give you an idea of just how long I've been involved in healthcare around our community, among other things that I've been involved in. Thank you.
Does anybody have anything they'd like to say, or let's go ahead.
Just welcome. We're happy to have you. And please reach out if we can help or support you in any way. Thank you.
Thank you. I look forward to contributing to this board's work. Thank you.
Yes, I'd like to join my colleagues and welcome you, and especially with your extensive experience in terms of the history. We have a lot of conversations we would like to talk with you about, and look forward to working with you as a partner here.
Indeed. Thanks.
Glad to have you on this board, Manager May, and really looking forward to learning from your leadership.
Thanks.
Do you know everyone on this board? Do you know these folks?
I cannot say that I do. I've worked with you before several years back, when you were obviously with the City of Austin's Public Health Department. But I can't say that I know, and I think I've worked with Dr. Samora in the past as well. Yes.
Welcome.
Thank you.
And have you met Dr. Martin?
Welcome.
First time. Good to meet you, Dr. Martin.
Okay. So I'm going to put you on the spot and ask you to just tell her a little bit about yourself.
I too have lived here for eons. Went to college here, went to medical school in Dallas, and have been back practicing since. I've been involved in the development of Project Access and other care for the underserved in the community. So it's been a large learning experience on the board for me. So it's been great. Welcome.
Do you guys know her? Do y'all want to tell her a little bit about yourself? Mm-hmm.
Excuse me.
Please do.
Well, I'm glad to meet you, and we'll surely talk more offline. My background is largely in nonprofit health and human services, where I've been working as an executive for quite a while here in Austin, and maybe 25 years in the space. So I think a lot of our expertise, at least in as much as routing or braiding public dollars with philanthropic dollars to be able to achieve the optimal outcomes that we can in equity and health is definitely common stomping grounds for us. And I'm really, really excited that you're bringing not only that skill set, but of course the massive skill set associated with the creation, of course, of the district. And as you even mentioned, the first mammography machine is kind of mind-blowing. So really, 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 really happy to meet you. Thanks, Chair.
Well, my name is Maram Saita. I'm a public health researcher and a public health doctor as well. And my research is primarily focused on health inequities and disparities in cancer. So I'm happy to have another cancer advocate on the board. So I hope that we can move along cancer care for our underserved population within this community. So I look forward to working and collaborating with you.
Thank you. Thank you. Welcome. Okay, I'll now move us along. And let me just say that, Dr. Lee?
Sorry, Chair Kitchen. If I could just add my welcome,
Yes.
Lisa. I'm thrilled and honored that you've joined us, and I want to congratulate our city colleagues for appointing you. Can't wait to learn from you and work with you, and hope to see you soon. Welcome to the board. Thank you.
Okay, so our first item of business is public communication. And as I said before, first off, let me back up for a minute and just say, so Lisa, don't get used to the meetings this short. We are trying to make our meetings more contained, but today is unusual because we wanted to allow time for those that wanted to or could to go to the commissioner court. We work very closely with the commissioners. So with that said, our first item of business is public communication. And as I said before, we receive public communication for both the executive committee and the board of managers meetings, and we're moving those now to 5:30. Members of the public who wish to make comments virtually must have registered with Central Health via an online form or by telephone no later than 2:30 today. So do we have anyone? I know we're not quite at 5:30, but I want to check and see if we had anybody to sign up. Okay. Pardon?
Yes, Madam Chair, we have one person signed up, Manager Maram Musaitis.
We have one person who signed up today?
Yes, Manager Maram Musaitis signed up to speak.
Okay, thank you. So would you like to proceed?
Sure. If you want to.
Yes, I can read the guidelines for this meeting's public communication.
No, I'm good. I think I should be fine. Really, the essence of today is really honoring April's Arab American Heritage Month. As probably many of you may know, I am a Arab American, actually what we call a Palestinian American. I was born in the U.S., in a small town, Waukegan, Illinois, and I just wanted to, just to backtrack, really the essence of honoring Arab Americans is their contributions to the American society. And we have been in this society for decades, and we have contributed several across different spheres. And today I just wanted to give you a story about a couple of those who have really inspired me and who I owe it to them why I am here sitting alongside with you. So starting, I just wanted to really clarify a couple things. If we can proceed, this is something that a lot of people may get confused about Arabs. Not all Arabs are Muslims, and not all Muslims are Arabs. So when we're talking about Arabs, those who come from Arabic countries and who speak the language Arabic. And I do speak, I am bilingual in Arabic and English. Just wanted to make that clear distinctions. And there are Christian Arabs as well. You may have not known, but we in Middle East, we actually live side by side, and several of them really share several of our culture and language and food. Our community is very rich in our culture. We are very hospitable people. If you've ever came and visited my home, you know that you will leave with a sack. And just wanted to highlight that. Moving along to our next slide, I wanted to share my grandparents. My grandfather immigrated to the U.S. in the early 1960s, and he brought his family. My uncles were born and raised here, and so I am considered more of a second generation, and if it wasn't for him seeking a better life for his family, we would not have been here. Just wanted to honor them, and that is at their home in Palestine. My grandfather, my late godfather, just passed away a few years ago. It was a sudden death, and he actually, when he came to the U.S., my grandfather was a janitor. He worked for Abbott, and here we are, and now I'm the first doctor in the family. So it just tells you about how our community is resilient and the impact that we have done throughout the years. Moving along to my final picture, I just wanted to highlight a friend, a dear mentor, Inshad Abu Zaid, who passed away last Friday. She raised two beautiful children, one who graduated with a PhD from Stanford, the second one, her daughter, she completed her undergrad at UT Austin and now is a lawyer in practicing law. And the beauty of Inshad, who passed away due to cancer, is that she helped co-found an organization called Texas Muslim Women's Foundation. And that organization really empowers all women to provide them with safe spaces, especially those who have been experienced domestic violence. And her organization helped support these women who came from all walks of life, and it's not just for Muslims, it's for all women, and really has had a lasting impact on generations to come. I want to honor her legacy of the work that she has done as an Arab American and for this world, and I know that she would be very proud of all the accomplishments that her children have made and for really paving the path for others. And she actually inspired me to really do community service and to, I always looked up to her, and there's not really enough words to really share. She was one of those really special individuals who just wanted to make a difference. And may her soul rest in peace, and others. And really, in honor of Arab American Heritage Month, I wanted you to all know that we are your friends, your family. You know, many of my family members are probably also mixed cultures. I have cousins who are also Latina, who are American. So we have really been integrated within the society. We are your doctors, your teachers. We are humans. And we try to do our best and to raise our children and with the values of loving and caring and being empathetic. And those are the values that we have instilled and continue to move within this fabric of the United States society. And that concludes my honoring this month. And as you may see, I'm wearing a traditional clothing, and this is hand-stitched by Palestinian women, and this is really part of our culture and who we are. And thank you all for always welcoming and embracing me, and I know part of the individuals that we also serve, a larger population, are from the Middle East, and I hope that we can look at it from their lens and deliver the most compassionate and empathetic care for all. Again, thank you all and appreciate the time. Thank you.
Thank you. For all of you, just, we have started our tradition and practice of honoring cultures that we work with and spending time at our board meetings when we have a Heritage Month or other activity. And so thank you for doing this for us today. Really appreciate that.
Could I add something?
Yes.
Thank you for the lovely presentation. I'd like to make a comment. I grew up in Spain, and we were deeply influenced by Arabic culture. And I don't know how much Americans truly understand the effect it had on American culture. The guitar, mathematics. Newton would have not discovered calculus without algebra. And I and Dr. Zamora suffered through free fatty acid discovery by a friend of mine's father was a Guggenheim Award winner for free fatty acid discovery. So that's contributing enormously to our society. And I think people forget that very frequently, that all these cultures, the beauty of this country is how people have come together. And we need to fight to sort of make that keep happening. Thank you.
Thank you. That was nicely said. So I'm going to move on now. I want to say a word about our mission moments. I think that I understand that we will be we will have the person who is going to do that today do that next month. But this is something we also recently started in the last few months, and just a reminder for all of us and for the public that our mission moments are brief presentations through which we'll have staff or patients or community members will share with us their stories of how our mission is connecting people to healthcare and health coverage and giving them an opportunity to live healthier as Central Health builds a better healthcare system for Travis County. So we wanted to bring those mission moments here, both for us as board members, as well as the public who participates or who may be listening to our meetings, to just remind us all what we're here for and remind us here of the people that we're serving. And so that's the purpose of the mission moments, and we will continue. We've done a couple of them now, and we'll continue doing that every month. So now I'm going to move on to our first item of business, which will be the consent agenda. The first consent agenda item is to approve the minutes of the Central Health Board of Managers meeting, and the second one is to receive and ratify Central Health investments. So do I have a motion for the consent agenda? Motion,
I move that the board approve consent agenda items C1 and C2.
okay, and a second from Manager Matwani. Okay, all in favor?
Aye.
Okay, it's approved. We'll now proceed to the regular agenda. And item number 1 is to receive an update on fiscal year 2024 budget resolution priorities, including an update on the employee engagement survey platform, organizational growth, and joint tech systems. So managers, we're not going to have a presentation on this item, but there are materials in your backup, and staff are available for questions. So I will give us a minute or two if anyone has had a chance to look at that and has any questions at this point. No questions? Okay. Okay. That gives us an update on, several of the items that we're proceeding with, so I appreciate that in the backup. So I'm going to move on to item number 2, confirm the next regular board meeting date, time, and location. Managers, our next Central Health Board of Managers meeting is tentatively scheduled for May 22nd at 4 p.m. or immediately after the executive committee at this location, 1111 East Cesar Chavez. Okay, we have been alluding to this all evening and sort of mentioned it, but just wanted to say again that we're going to adjourn the meeting early. I guess it's going to be 5:30. And several of us, and everyone is welcome. I just wanted to say that several of us are able to attend the county judge's State of the County address at 6:30 this evening at 700 Lavaca. Everyone is invited to attend, and the community will be joining us there. At this time, I'm ready to accept a motion for adjournment. Manager Musaitif, a second from Manager Zamora. All in favor?
Aye.
Aye. Okay. All right. Thank you all.